All right. Good afternoon. This is the Public Health Minority Health Disparities Subcommittee of the House Health Committee of the Maryland General Assembly. This is March 3rd, 2026, and we will start with HB 866, Office of the Deaf and Hard of Hearing. We'll ask council to do the summary.
Thank you, Madam Chair. Originally, the bill required the Office of the Deaf and Hard of Hearing to provide specialized case management services to certain individuals, but we have an amendment from Delegate Kaufman that strikes that bill language and instead extends the work group for the deaf, deafblind, and hard of hearing for 2.5 years until December 31st, 2028.
Delegate Kaufman, did you have anything you wanted to add to that presentation?
Yes, I wanted to add hot off the presses that it says these from the Governor's Office of Deaf and Hard of Hearing, these costs can be absorbed within our existing budgeted resources. We do not anticipate a fiscal impact requiring additional funding in light of the extension of the work group.
All right, thank you. Can I have a motion on the bill so that we can then open up for discussion?
So move.
Second.
Thank you. Okay, open for discussion. Is there anyone who is a stakeholder who has anything they'd like to add to what the delegate has just said? Okay, I don't see any hands. Are there any members that have any questions or comments they'd like to make on this bill? All right, seeing no hands, may I have a
Move the bill.
well, actually, we have to move the amendment. I went out of order. Can we Move the amendment, please.
Move the amendment.
Second.
All right. All in favor of the amendment signify by raising your hand, either virtually or in the flesh. I see hands
Aye.
up. Okay, I see Delegate Riley, Delegate Hutchinson, Delegate Kaufman, Delegate Martinez, Delegate Alston, and myself. Okay, all right, very good. So the amendment passes. May we have a motion on the amended bill?
Move the bill, Madam Chair.
Okay,
Second.
second, good. All in favor, raise your hand or say aye.
Aye.
Okay, Delegate Hutchinson, Delegate Riley, Kaufman, Martinez, and Alston. And I didn't see the Delegate Warman. Okay, see, I don't, okay. All right, okay. And me as well. So the bill passes unanimously, I think. Yeah. Okay, very good. Okay, let's go on to House Bill 181.
This bill requires a restaurant to offer a written disclosure of each main food allergen that a restaurant knows or reasonably should know is contained as an ingredient in each menu item. The disclosure must use common names of the main food allergen or standardized pictograms. The disclosure may be written on the menu, available in a digital format such as a QR code, a separate allergen-specific menu, an allergen chart, grid, or booklet, or any other written material. The bill does not apply to prepackaged foods that are subject to federal labeling requirements for main food allergens. A restaurant that violates the bill's requirement is subject to existing civil and criminal penalty provisions for food establishment. We did
Okay,
have some, I'm sorry, Madam Chair.
go ahead. I'm sorry. You were going to tell us
We
about
did
the
have some amendments. I haven't received the final copy of the amendments, but we did have some amendments in concept from the sponsor. Would
Okay.
you like me to describe those?
Please describe, yeah, the amendments, please.
Okay. So what I have is there was a different definition for restaurant, but a disclosure under this section is based on ingredient information known or reasonably available to the restaurant and doesn't constitute a guarantee that a menu item is free from cross contact with a major food allergen. A restaurant shall make a reasonable effort to inquire whether a customer has a food allergy If the customer fails to disclose a known food allergy after being provided notice under the section, the restaurant may not be held liable for that failure to disclose. A restaurant that acts in good faith to apply with this section and relies on ingredient information provided by a supplier or manufacturer is not subject to liability for inaccurate allergen information resulting from erroneous or incomplete information provided by a supplier or a temporary change in supplier outside of the restaurant's control. Nothing in this section may be construed to alter, limit, or expand any duty a restaurant may have under other applicable law to reasonably ensure the safety of its patrons. If a restaurant uses an alternate supplier for an ingredient and the substitute ingredient contains a major food allergen not previously disclosed, the restaurant shall update its written disclosure or provide notice of the change in a manner consistent with this section. Displaying clear allergen signage or standardized language in a conspicuous location. I guess these are mandates, so it must be displayed in a conspicuous location, must use standardized symbols or icons, must use any other comparable method that provides written access to the required disclosure. A restaurant is required to update a disclosure only when there is a change in ingredients or supplier information that affects the presence of a major food allergen. The department shall consult with the representatives of the restaurant industry and food allergy advocacy organizations in developing guidance or regulations to implement the section. The department may adopt regulations as necessary to implement the section. And a restaurant that operates 2 or fewer locations nationwide shall have an additional 6 months after the general effective date of this act to comply with the provisions.
Okay,
There was also a separate amendment that was offered before that, which is much shorter, that updates the title, but instead of it being main food allergens, it changes it to major, and it lists a list of those major food allergens. So crustacean, shellfish, egg, fish, milk, peanuts, sesame, soybeans, tree nuts, wheat, or any food ingredient that contains a protein derived from those things.
okay. All right, thank you. Very quickly, is there anyone here from Delegate Wood's office? Okay, then what I'm going to do is I'm going to pin that. That was a lot of stuff, and there's going to be one question to bring everybody to Kumbaya. So let's hold that, not for the day. I'm going to hold it until we hear the next bill. And I'm going to go ahead and I probably should have taken the recommendation from council. Let's hear 1364, the speaker's bill, and then we'll come back. Those were a lot of amendments, and I want to make sure everyone has a chance to weigh in on them. So we're going to do 1364, then we'll come back to 181 now that we've heard the amendments. And hopefully we'll have someone from Delegate Wood's office here at that time. Okay, 1364, please.
This bill requires a center where mammography testing is performed to include in screening results. Oh, I'm sorry, I misread. This bill requires a center where mammography testing is performed to include in screening results letter that is sent to the patient as required by federal law, a specified notice about breast arterial calcification. There was an amendment offered by the sponsor, which really was just, instead of making it a separate clause outside of the breast tissue density notice, it just incorporated into the existing notice.
Okay. All right, thank you. Anybody from the speaker's office want to speak to the amendment or the bill? Yes, Ms.
Hi.
Hopwood. Ms.
Hi, Madam
Hopwood.
Chair. It's Erin Hopwood. I am Legislative Director for the Speaker. And the amendment is actually a clarifying amendment. Under current law, if federal regulations change related to breast density, the breast density notification requirement is something that would be taken out of the notice. So we just had to do amendments that made sure that that change in federal law related to dense breasts had no effect on the notification requirement related to arterial calcification.
All right, can we have a motion on the amendment so we can open it for discussion?
Move the amendments.
Second.
All right, thank you. It's been moved and seconded. Any discussion on the amendments? Are there any other stakeholders who want to weigh in on it? No. Are there any questions or comments from the members?
Just fatigue that lasts a few days.
Okay, all right, so it's
Bill.
been moved and seconded.
Oh,
All in favor
Second.
of the amendment, raise your hand or signify by saying aye.
Aye.
Okay, I see Hutchinson, Riley, Kaufman, Martinez, and Austin, are you? No, okay, all right, so the amendment has passed. Can I have a motion on the amended bill?
Move the bill.
Second.
Okay, any additional comment? Okay, let's vote. I'm calling the vote. All in favor of the amended bill, signify by raising your hand or saying aye. Riley,
Aye.
aye.
Kaufman, Martinez, Austin, Hutchinson, and Hill. And Warman has not been voting on anyone, so let's make sure we note her as abstained on all the votes we've taken. Okay? Thank you. Okay, thank you very much, Aaron. All right, let's get back to HB 1364. Is there anyone from Delegate Wood's office here?
You mean 181?
I'm sorry, 181. Thank you for the correction. 181?
We've tried to text her aide, Madam Chair.
Okay, that's fine. Thank you. Delegate Hutchinson, you had something you wanted to talk about on this bill.
I do. I actually think this bill has completely gotten out of control and has been hijacked. I literally just talked to Delegate Woods leaving the House floor, and she took me over to Delegate Foley, who also had a similar bill that they merged together. To be crystal clear, the intent of this bill, according to Delegate Woods, is nothing more than a restaurant has to put either on a whiteboard, on their menu, or a QR code, a listing of what the 9 allergens are. And if you have any of those 9 allergens, you need to notify the wait staff. That you do, so then they can make the accommodations to address that. This bill has morphed itself into, from the advocate, that every menu item had to be listed, every ingredient that was in there had to be listed. And that's where this bill, in my opinion, had become incredibly onerous. And so I just got that directly from the bill sponsor, that the intent of this bill, if it's anything other than that, then that is not the intention of this bill. So I think we need to go back. We need to look at these amendments and make sure that this is really addressing what Delegate Hill wants and not what the advocates have been driving.
Or Delegate Woods wants. Okay.
Delegate Woods, yes.
Okay, Delegate Woods, you offered a slew of amendments. We had them read. Are you asking us to take up all the amendments or some alternative to the others? And if we do the amendments, how close to Kumbaya does that bring us?
So at this stage, to just be the most specific part and the most important part of the amendments is that we want to assure you that we are not requiring that this allergen information be listed on every menu with every food item being broken down. Our goal, the intent of our goal is that the 9 allergens are listed, that the restaurants have the opportunity to make a selection as to how they relate this information. That is, they can do it. This is an either or a both and. They can list the information via a blackboard or a whiteboard in the restaurant. They can have QR codes on the table that customers can scan that will tell them what the main food allergens are, as well as listing that for particularly for your smaller owned restaurants, that sometimes these smaller owned restaurants rely on a different supplier. And in the instance that they rely on a different supplier, that means that the ingredients in that menu may change. And if the customer has a question, please speak with their wait staff. The other option that we give is that people are able to get, and this is an option again, that restaurant has a notebook whereby they can list their allergens either by each menu item or list the 9 major allergens and what could impact the customers in that restaurant.
So let me ask this quick question. You're saying that's what the amendments would do if we take all of the amendments? And if that's what the amendments do, and I have a new offering, some new dish,
Mhm.
do I have to identify for that dish which of the allergens may be present in it?
What we're asking the restaurants to do, if they have a new dish, to identify that they have a new dish, and if there are concerns about allergens, to please alert their wait staff.
Okay. All right. Let's hear from Mr. Thompson. Mr. Thompson, are you familiar with these amendments as described by Delegate Woods?
Thank you, Madam Chair, and thank you, Delegate Woods, for joining and clarifying your goals on this bill. That sounds a lot simpler than the bill language and even a lot simpler than the amendments that the subcommittee council just read. I think the way you described it would be more workable for our industry, but I would like to see that revised amendment in writing, and so that we can consider that and then come back to the subcommittee, because I think what the subcommittee council read earlier were not the amendments that reflected the goals of what Delegate Woods just articulated.
So, Mr. Thompson, I haven't seen your offered amendment other than limited to these very large places, which I think it has been the sense of the committee we don't particularly want to do. So if you want to offer the amendments and work with Delegate Wood's office to come up with the amendments that address what she has said, instead of having her keep coming up with amendments and bouncing them back, then we'd like you to be able to do that, and so that we have it and we can move this bill next week. Thank you.
Thank you very much, Madam Chair. We will do that, and thank you, Delegate Woods. We'll be in touch with your office.
My pleasure. Look forward to it. Thank you so much. Thank you, Madam Chair.
All right, thank you. Any other discussion from members, questions or comments? Okay. All right, let's go on now to let's go on now to House Bill 922. Chris, please.
Sorry, I was still on mute. This bill requires the Behavioral Health Administration to adopt regulations that authorize the behavioral health program to relocate to another site. The regulations must provide an expedited approval process for the relocation of an existing behavioral health program separate from the application process for a new program, authorize a relocating program to use documentation previously submitted to the administration if the documentation is unchanged or not relevant to the relocation, authorize temporary approval for a relocating program to begin practicing at the new site upon determination by the administration that the new location meets safety standards, authorize the administration to consider the program's regulatory record as a basis for streamlining the review and approval process for relocation, and require the administration to provide clear timelines and standards for the review and approval process for relocation. And I have not received any amendments for this.
All right, Delegate Hutchinson. Tell us what you want us to know and tell us about that fiscal note.
Well, the fiscal note indicated that they had to have a resource to be able to expedite a process, and which is a process that eliminates steps in the process and still treats any new behavioral center that needs licensure as if they've never existed before. So I don't quite understand the need for that additional resource in streamlining a process, not expediting a process.
Okay, let's ask the department. Who's here to speak on behalf of the department or the Behavioral Health Administration or whoever?
Good morning, Delegate Hill, Megan
Hey.
Lang, Director of Government Affairs.
Tell us about that. Why in making things simpler does it require, what, 154,000, et cetera, et cetera? What's going on here?
Sure, absolutely. So I think a lot of what we're trying to emphasize, right, with this, both our fiscal note and our letter, right, is that we oversee approximately 1,100 community-based behavioral health organizations across about 5,000 sites in the states. And so creating a separate expedited approval process will require us to bring on new sites, right, to ensure that as programs move to these new sites, they are meeting what's set out in COMAR. 1063, which a lot of folks on here may be familiar with, right? So that, and please excuse me, I'm a little under the weather this morning.
I'm sorry to hear that.
And so, right, I think we can understand and certainly appreciate the host, we certainly can, appreciate the understand to make the relocation like less burdensome, right? I think there are just so many providers that we are working with in the state where we're hesitant and very cautious, right, about the work that is going to be involved for the department to actually get this up and running.
Okay. First of all, I'm sorry you're not feeling well. Second of all, let's go ahead and have a motion on the bill and then we can continue discussions. I should have done that first. Delegate Hutchinson, you move the bill, please.
Move the bill.
Second.
Thank you. Okay, I'm going to open up for questions because I will tell you, Megan, I really didn't quite understand the need for sites, but I want to let my members ask their questions. Delegate Martinez.
Thank you, Madam Chair. And this question is for Megan, because I'm finding this to be like a theme with fiscal notes this year. Is it that the department just simply doesn't have capacity, and so that is why we're tacking up cost? Or is it that there are genuine concerns around this process that's being laid out in the bill, or both?
Sure. Thank you for that question, Delegate Martinez. I do appreciate it. I think it is genuinely a little bit of both, right? I think what this bill does creates a new process internally that we don't have staff to support, right? And so we want to be responsive, of course, to legislation, right, when it passes. So we are wanting to make sure that we are, adequately staffing internally, right? There is a very small licensure team that exists currently, and they work very hard to get through approvals as quickly as possible. But when these sites are requesting, an extension or relocation to a different place, there is due diligence that the department is required to do, and we just want to make sure that we are, we are appropriately meeting that.
Any other questions? Because I have one. Megan, Delegate Riley.
I have a question. I'm sorry, I was actually in another bill hearing on this day, so I didn't hear the the actual bill hearing. So is this the issue to where, and I guess this is addressed to the sponsor, to where in Eastern Shore we had a facility that moved like a block or two? They were already established, had a license, had no violations, no nothing, and they were actually adding 30 beds to the new location 2 blocks down the road, and it took them like, I don't know, 6 months.
You're somewhat on, I'm sorry, Madam Chair, may I speak?
Yeah.
Please,
Yes.
Delegate Hutchinson.
Delegate Riley, this is somewhat similar to what you're describing there. I'm not so sure about the addition of the 30 beds, but it's an existing behavioral health facility on the Eastern Shore that moved a couple blocks within the city of Cambridge. But this is not the first time this has happened to them. As they've been growing over the last 10 years, they've had to move numerous times. And so they then have to keep 2 facilities up and running at the same time, paying double rent while they're waiting for what is an organization in good standing to go through the existing process as if they're a brand new center asking for application. And so what I really want to make sure that I stress here is that this is not a new process. What we're doing is just modifying an existing process. So that's why should an existing health facility go all the way back to the beginning of the line when they have met a number of the steps already accomplished?
Okay, Delegate Riley, does that answer your question?
Yeah, absolutely. I agree. And yes, I did personally speak with these folks, and they were actually adding beds to the facility.
Let me ask, let's get back to Megan. I know we're advocating for a particular issue, but I want to get an understanding of her explanation, if you may. Megan, you keep saying we'd have to add additional sites. We're seeing it, and I think I'm speaking for most, if not all of the members, as someone who's already established sends you an application and says, want to open up a second site. You look and say, oh, okay, we're familiar with these folks. No violations, whatever. If there's an inspection or so, I'm not sure what all the steps are. Maybe that's the part that's missing. But if you can go through their application and check off a lot of stuff, why aren't there steps you can skip? Because they're already an established good actor. That we're looking for the steps you can skip, and you're saying there are none, and that's what we're confused about.
I hear you, Delegate. What I will do is, I think in a vein to make sure that I am not misrepresenting the process for folks, what I will do is I will have our Behavioral Health Administration sketch out the difference between initial licensure and then the relocation piece as well.
Okay, and if you can just send that to council so he can distribute it to all members of the subcommittee so that we have it before next week, because this, again, to the untrained brain, which I'm speaking for myself now, not for the rest of the committee, it doesn't make sense. Okay? All right, thank you.
Yep, absolutely.
Delegate Hutchins said one more thing that you wanted to ask or add before we move on to the next bill.
Well, I think the advocate wants to have something to say too.
Okay, and who is here?
That'd be Beth Ann Dorman from For All Seasons.
I'm not seeing her on my thing. Okay, Miss Dorman. Dorman, hey, how are you?
Good morning. Thank you so much. I just wanted to make a piece of clarification. And Megan, thank you so much for sort of the perspective. And we certainly want to work to minimize the work that BHA has to go through. I just want to make sure that we're clear that this is not about opening a new site. It is about relocating. So we already have an existing license in the town in which we are providing service. This is about simply moving down the street. So while I understand that if you're opening a brand new office in a brand new location, that might be one thing, but what we're talking about is simply moving to a new address, kind of like as I said to the committee last week, really what we're talking about is a change of address form. It's not about starting new services in a new area. It is simply about expanding offices to be able to provide more services to more people, which is the goal that I know that we all want to work towards together. Thank you.
Great, thank you. So Megan, that's the assignment, is to find out why it costs so much money to come up with a change of address form, and why you all don't feel that having an established good actor in the field can't simply change their address and notify you that they're moving their office, as happens with other medical facilities, right? Okay.
Yep. We'll be happy to lay that out for you, Delegate.
All right, thank you. Okay, let us now go on to the next bill, and that is HB 939, Certificates of Birth Filing Time Period, and that's Delegate Rosenberg. Delegate Rosenberg, thank you so much for being here and for your patience.
This bill increases from 5 to 12 calendar days the period of time following a birth within which a certificate of birth must be completed and filed with the Department of Health. I was not afforded any amendments for this one.
All right, Delegate Rosenberg, can you speak to this bill?
Yes, this is a bill that is the midwives came to me, their representative, Caitlin McDonough, aware of the issue that this raised. One of the issues that was raised by this bill that necessitated the bill is the fact that in the Jewish faith, the male is circumcised on the 8th day and does not get his name until that 8th day, so that the current 5-day time period is insufficient for these families. And so I know there has been discussion of, as suggested by the chair, to amend the existing law to provide that a 5-day, an exception would be provided to the 5-day for a religious observance. And that is something that I'm waiting to hear back from Ms. McDonough as to where her client is on the bill if it were to be amended in that manner, if I could defer to her at this time.
All right, let's first move the bill and then we can have that discussion.
Move favorable.
Thank you.
Second.
Thank you. Okay, Ms. McDonough.
Yes, Kayla McDonough on behalf of Maryland Families for Safe Birth and the Association of Independent Midwives of Maryland, and specifically our out-of-institution midwives who primarily serve the Orthodox Jewish population here in Maryland. We're certainly open to some amendments that would maybe clarify how the bill would apply. Our intent with I haven't seen any language, so I think we just want to better understand how a religious exemption would operate. What a family or an individual would need to do to kind of demonstrate the need for longer time. I think what we're trying to avoid and what we have in place under the current standards is you can submit registration in the 5-day period without a name, and then you kind of have to go through these subsequent steps to get the information amended, which has been burdensome to both the providers and the families in these kind of limited circumstances. So if it's kind of replicating that process again, I think we would have some concern. I did try and look at other states. We do see most states kind of resolving this issue with an extended time, with the understanding that only, a very small amount of the population actually seeks the full time, and we still see the majority of births being registered actually in the first 48 hours while they're in hospital, and not even, taking as long as the current 5-day deadline. But, we're certainly happy. And I didn't know if this was coming from particular member or from the agency or Vital Records, but we would just kind of need to understand what that looks like, but certainly open to amendments.
All right, thank you. So just for clarification, before I ask members for their additions, since I'm the one that asked, I was looking at the testimony from the department with respect to Vital Records, and particularly what they have to do to be compliant. My understanding was their testimony said, first of all, 99 point some fraction % of folks comply, that they do, as you stated, Ms. McDonough, give the option of filing without a name and then with a notary, notary then coming back and giving the name. I think your advocates suggested was a much more onerous process than what was presented. And so the question that I had is, and I don't think I've even discussed it with them, I wanted to see how the sponsor felt first, is that we keep it at the 5 days and give a religious exemption, which I would think for the department just being a statement saying that I elect, because of a religious exemption, just like we do for vaccinations and other things. It doesn't have to be, that we're submitting this that would otherwise be considered late, that it wouldn't be considered late as long as it got in by the 12th day. And that will apply to anyone who had a religious exemption for why they couldn't get that information in the 5 days. So that's the sense of the amendment. Let me open it up for discussion to the members if you have any other thoughts or questions about, and I'm glad to hear, Caitlin, that your folks are open to the discussion, but that's it. And any other thoughts about this bill from anybody? Okay, well, let me ask this. Let me ask Caitlin and Delegate Rosenberg if you all could talk to Vital Records or to the department and see if my suggestion actually makes things worse or would somehow be more acceptable than extending from 5 days to 12 days, the time that we're giving everybody to get this information in, because that's essentially what the bill does, is it says everyone gets 12 days. And whether or not, the idea that very few people will take more than 5 days now doesn't mean that if you're given 12, that you're not going to take them, right? So we've got a system that's working pretty well. I'd like to change it as little as possible. And that's why I'm asking for you all to have a discussion with them about whether that amendment would make it more palatable to them and still address the concerns of your client.
Happy to have that discussion. And just, I know some of our faith community was not able to be on this call today because it's Purim, but we'll loop them in on the conversation too, because I think they may have even had more concerns than my provider group too. So we'll happy to have that conversation. Thank you, Madam Chair.
All right. Is there anyone here from the department who was here to speak on that bill?
I can just say, Delegate, again, Megan Lynch here. Happy to work with Delegate Rosenberg and Caitlin. I appreciated their initial conversations and the flags. So please just keep us posted and happy to chat more.
All right. Thank you very much. Okay, let us move on to the next bill on our list.
If I may, Madam Chair,
yes.
When do you want to hear back from us? What's our deadline?
I would like us to be able to take this bill up next Tuesday. So I'd like that conversation to happen soon.
Absolutely, it will. Thank you.
Thank you very much. Okay, next let's go to House Bill 1012. Chris, please.
This bill authorizes a county or municipality to establish a multidisciplinary and multi-agency suicide fatality review team to prevent suicide deaths by 1, reviewing suicide deaths that occur within the county, 2, identifying systemic, service, and policy factors associated with risk of suicide, 3, promoting coordination between entities involved in suicide prevention, crisis response, treatment, and postvention, and 4, developing recommendations to prevent suicide. 2 or more counties may establish a single multi-county team, but they must execute a memorandum of understanding on membership, staffing, and operation. The bill outlines membership of a local team, requirements and recommendations for local team operations, and requirements for use of records and data. An individual guilty of violating the bill's meeting or data privacy restrictions is subject to a fine of up to $500 and/or imprisonment for up to 90 days. We did receive an amendment from Delegate Fair, and the amendments are kind of extensive. What I can say is that the amendments clarify that a local team must coordinate with certain local child fatality review teams, as well as the State Suicide Fatality Review Committee. The bill now amended provides certain immunity for certain actions taken by a person as a member of a local team. It authorizes the local team to request and receive certain information. It establishes that a local team is a public health authority conducting activities in accordance with federal law. And it provides that certain information acquired by the team is confidential and exempt from disclosure under the Maryland Public Information Act. In addition to that act, discovery or being introduced as evidence in a proceeding.
Okay, thank you. Delegate Fair, what is going on here with all these amendments? And tell us about this bill.
Yes, thank you so much, Madam Chair. Appreciate the opportunity, and hello everyone on the subcommittee. Proud to be here to talk about the Suicide Fatality Review Commission that we're trying to put together for local behavioral health organizations and health departments. So the amendments, I'll just stick to those to start with. The amendments are really designed from the Maryland Department of Health. They're meant to bring better clarity and a lot more clear lines of communication between the state Suicide Fatality Review Team and the local fatality review team, which currently exists in every jurisdiction, which is the Child Fatality Review Team. So that way we're making sure we're coordinating messaging, discussions, and things that are happening. Not every child fatality is a suicide, but some suicides are child related. And so we want to make sure that there's coordination there. And then the Maryland statewide fatality review team, they're looking at this issue from a 10,000-foot level. So we want to make sure that our information helps to inform that information at that high level. And so really the amendments are just designed to clarify a few of those pieces. There's some administrative components to it, as Chris mentioned. Thank you, Chris, for taking the time to explain all of that. But there's some administrative pieces about PIAs and making sure that we're being very protective of this information. These are usually deeply traumatizing conversations about very personal situations with individuals. So we want to make sure we're being as careful as possible and as deliberate as possible when it comes to how this information is discussed, and more importantly, really how this information is shared publicly.
All right, let me have a motion on the amendment so we can discuss the amendments.
Move the amendment.
Thank you. Do I have a second? No second?
Second.
Okay, thank you, Delegate Austin. Delegate Fair, what prompted these amendments? Was this a discussion with the department? Was it some best practices that you all came across after the bill was introduced? The amendments are longer or close to being as long, if not longer than the bill. So tell us about that.
Yeah, absolutely. And I defer to Ms. Lynch on the exact composite, the necessity of the amendments. I'll say that we were running up on some billing timelines as the bill was coming forward. We had asked MDH to weigh in early on this, way back at the beginning of the
These are
session.
MDH, these are really at MDH's request. Is that what you're saying?
Correct.
Got it.
That's
Okay, so there's sponsor amendments at MDH request. That's where I needed the clarification. Thank you. Delegate Riley.
Thank you, Madam Chair.
Thank you, Madam Chair, and I guess this is for Delegate Fair. So these amendments, I mean, the bill is amazing. You have a lot of favorable testimony. So does this change any of the testimony? Like, for instance, Mako, is everybody still on board with this bill with all of those amendments? That's all I need to know. So have they seen them? Have all these groups seen the amendments and they're okay and we're all good?
I've heard, I'll just say the local health officers who pushed this bill in the first place are fine with the amendments. They were the main pushers of the bill. So we have not run it by every individual stakeholder. I don't want to lie to you and tell you something that's not
And
true.
it is an enabling bill. There's no mandate, correct?
Yeah. What's that? There's no mandate. It's enabling.
Right, it's enabling.
Okay.
Yeah.
All right. Thank you.
Thank you.
Okay, any other questions? Okay, is there anyone who, Megan, do you want to confirm that the department is good? These are amendments that you guys requested?
I can confirm that, and I express deep gratitude to Delegate Fair, and I see Dr. Brookmeyer, our local health officer from Frederick County, and I'm grateful for their willingness to meet with us and really kind of go through in depth to just make sure that the language was in compliance with what was happening at the state level, and I think we've got a great bill here.
I will.
Thank you. Thank you, Delegate. Dr. Brookmeyer. You want to comment? You waved at us.
I got somebody, so.
Perfect. Brookmeyer, you wanted to say anything or you're good?
Dad's gonna come.
Okay, Delegate Kaufman.
Delegate Kaufman, you're not muted.
Yeah.
Sorry.
Okay. Did you want to say, yeah, no? You're on?
I'm sorry. Yes, hi. Took me a while to find it because I'm on my phone. So I'm Barbara Brookmeyer. I'm the health officer in Frederick County, Maryland. And my colleagues, the other health officers throughout the 23 other jurisdictions, are supportive of this bill. And several of us it's been something we've wanted for a few years. So we're glad that it's actually made it this far, and we appreciate the support and the interest.
All right, thank you. We've got a motion. I'm sorry, Chris, you wanted to say something before we take the vote?
I just wanted to clarify that we did see like a couple of additional things to add to this amendment. So these amendments that you were voting on really aren't complete, and they need to be redrafted to include what the department is sending in addition to these. And they're small changes, really just technical changes. And there's a change about the local child fatality review team for a suicide death involving an individual under 18. Retains the primary authority to conduct the review in accordance with Maryland law. May coordinate or conduct a joint review with the local team. Nothing in this section may construe to supersede, limit, interfere with, or otherwise affect the authority or duties of a local team under the law. So those are just some, I think, clarifying things that need to be updated into this amendment.
So are we treating that as the in-concept revisions of the amendment that we've moved, or as a second amendment?
In concept, because I can just add these and make it into one.
Okay.
These are conceptual amendments. Friendly.
Can I have a second? Well, we have a motion on the floor on the amendments.
think I'm-
And so you want to amend the amendment on the floor to include the conceptual changes?
Yes.
Okay, can I have a second on that?
Second.
Okay, Mr. or Dr. Nestat, you had something to add?
Yeah, I'm was asked to come in just to comment. I'm the chair of the statewide Suicide Fatality Review Committee. And I submitted written testimony. I just in very strong support of this. I want to just make sure that the committee knows that Maryland has become the gold standard for these suicide fatality review committees. We were the first statewide legislated one, and I have other states coming to me at suicide prevention conferences asking how Maryland does it, and for advice on it. This would make it more in line with how the opiate fatality review committees work.
Okay,
yes,
and I don't want to redo the hearing. So
sure.
I see, Ms. Reed, good. Okay, thank you. So we have moved the amendments, both as written and the modifications of the amendments as read. Any more discussion from the members? Let's have a vote on the conceptually modified amendments offered by the sponsor. Okay, all in favor, hands up. Virtually, I see Delegate Riley. I see Delegate Hutchinson. I see Delegate Warman, Delegate Austin, Delegate Martinez, Delegate Kaufman, and myself. So they're moved unanimously. Can we have a motion on the bill as amended?
Move the bill as amended.
Thank you. All right, thank you, Delegates Austin and Riley. All in favor, hands up. And Delegate Hutchinson's ahead of the game. He's got his hand up before the questions even.
I have a question.
Or you actually have a question. Hold the vote. Hands down. Hands down.
Sorry
Hold
about
the presses. Delegate Hutchinson on the bill.
I think you took care of this, but you both spoke at the exact same time. So I just want to hear clearly that this is enabling legislation.
Yes, it is. It's enabling.
Thank you.
All right, very good. Now, vote on the bill as amended. All in favor, hands up. Delegate Riley, Delegate Hutchinson, Delegate Kaufman, Delegate Warman, Delegate Austin, Delegate Martinez, Delegate Hill. It is unanimous. Thank you very much. And thank you all for being here. And let's go on now to our last bill on the list. Delegate, let's see, House Bill 1263, Work Group on Postoperative Cosmetic Care, Delegate Hill. Oh, wow.
Sponsor problem.
It's a sponsor problem here. Let's vote this one down. Okay, Chris, can you talk about this bill?
This bill establishes the Work Group on Postoperative Cosmetic Care to study the regulation of postoperative cosmetic and body-altering services provided by non-physician practitioners with the focus on patient safety, consumer protection, and continuity of care. Members of the work group representing government entities must designate staff from the respective government entities to staff the work group. The work group is not a regulatory board and may not establish a licensure program without legislative approval. The work group must, by December 1st, 2026, submit an interim report, and by December 1st, 2027, a final report of its findings and recommendations to the Governor General Assembly. The bill takes effect July 1st of this year, terminates June 30th of 2028.
Okay.
No amendments.
Okay, so thank you very much. So I'm going to ask Delegate Hill to speak. Thank you very much, Madam Chair. Okay, so we actually are offering a sponsor amendment. I apologize that we did not get it to council ahead of time, but I did give testimony to it, that where the acupuncturists have been requested to be added to the work group, and we're fine with that. Can I have a motion on that amendment so we can open it for discussion?
Move the conceptual amendment.
Second.
All right, any discussion or questions about the amendment? Okay. Let's have a vote on the conceptual amendment to add the acupuncturist to, in the same way that the other specialties are added to the bill. All in favor, hands up. I see Delegate Martinez, Delegate Austin, Delegate Hutchinson, Delegate Riley, Delegate Hill, Delegate Warman. You're not voting on this one? Oh, that's a yes. Okay, so the amendment passes. Can I have a motion on the amended bill? So we can
Move the
have
bill as amended.
Thank you, Delegate Austin. And second, Delegate Kaufman. All in favor? Well, first of all, any discussion, any questions? Okay, all in favor, hands up, one way or the other. Delegate Hutchinson, Delegate Riley, Delegate Austin, Delegate Warman, Delegate Martinez, Delegate Hill, Delegate Kaufman, are you voting for the bill or you're abstaining, or will you be voting no? I don't see your hand up, so let me ask the question. Anyone opposed to the bill? Okay, anyone abstaining from the bill? Then we will reach out to Delegate Kaufman, who may be in transition, to see how he votes on this bill. And we'll get that clarification. Ms. Brown, did you have anything else you wanted to add?
I did not. Thank you.
All right. Okay, thank you. Megan, do you have anything you want to add?
Well, if you're going to offer Delegate Hill, then I might take up just to say that, we appreciated meeting with you previously on this. I think that I think there is a way, and certainly the department, the boards have committed to reviewing this without legislation, right? And the Board of Physicians, though I don't believe here, they do have what I believe to be quite a robust process on how they take up matters for groups that want to obtain licensure. And so I think, it'll be a similar process. So, we remain committed to working with you, Delegate Hill, because I do think there is a way that we can do this.
Okay, let me ask for the body's permission to withdraw the vote on the bill. And you all can say yes or no, but what I just heard from Megan is the department would like not to have legislation. They think they can do this without it. Delegate Martinez.
With all due respect to everyone on the call, there's a process in which we go about. If they didn't want the bill to move, there was ample opportunity for discussion. We as a committee have a lot of work product. We've moved the bill forward. If they don't like it, kill it in the other house, but we're moving forward.
All right, and I don't see any objections from my members. Delegate Martinez has spoken. We are good for the day. Can I have a motion to
Move to adjourn.
adjourn?
Second.
All right, thank you.